Hello there, everybody. Seja here, founder of the School of Evolutionary Herbalism and Natura Sophia Spagyrics, and welcome back to the plant path. And, one of the things that's really interesting about being an herbalist is that every once in a while you get to be your own guinea pig. And those really, turn into, I think, some of the really pivotal moments on our plant path, because we really experience a particular type of health problem, and then we experience a very particular type of remedial situation that is really important, I think, for us to understand our herbs through experience. And while obviously we don't want to go down the list and experience every single disease and cure it ourselves, that would be pretty horrible and uncomfortable. But boy, you'd be a really great herbalist if that did happen to you. We will all kind of experience our own challenges, right, along the way. And I think that's one of the ways I like to describe the plant path, right? Is that we're traveling through this life, we're walking on this road of life, and that we are going to get challenged, we're going to get sick. And that's, in a way, too, I think, a time of a testing point, right? A testing of our faith in our medicines, in our plants, in our remedies. What are we going to turn to when things get tough? And so I recently, in recent history, got sick. And at first that seemed like I had just a little cough, do cold, a little stuffy nose and a little sore throat, and kind of started for a few days. I wasn't feeling so good, but it was like, it's not really that bad. Like, maybe I just slept with my mouth open and I'm stuffed up, or, one of those things. How you kind of know you're getting sick, but you make an excuse. So that was me. So I was like, no, I'm not gonna, whatever, it'll be fine. And then pretty soon it's like, yeah, okay, the throat hurts. And then, okay, it's trying to get down into the lungs. So I did my normal thing of treatment, right? I did my kind of standard stuff that I do when I'm not feeling good like that. And within 2 or 3 days, it started to alleviate, right? And I was like, okay, started feeling better. And then I stopped, right? I stopped doing what I was doing. And then and I felt fine for 2 or 3 days. I felt good. And then all of a sudden, my nose got really, really congested, and really congested. And I didn't have any other symptoms, just really stuffed up nose, blowing a lot of boogers out and really mucusy, a little bit of a sore throat, but mostly just right here. And, so I was like, oh, okay, well, this cold's coming back. And so I went back on doing what I was doing, and that thing would not go away. And it just was so congested, so much mucus all day long. And then it got to a point where I wasn't sleeping at night because I couldn't breathe. And when I would fall asleep, I was like, my mouth would get so dry, my throat would get so dry, and then I kind of, wake up, and it was horrible. And I was just, what is going on? The things that I normally do, it was not working. And at one point during that time, I had an appointment with my naturopath that I work with more for other things, for my injury, my back injury. And so I was, appointment with him, and he was like, oh, are you sick, And I was like, yeah, I got this really stubborn cold that just won't go away. And he was like, well, how long have you had it? And I was like, and I started kind of doing the math. I was like, oh, I guess it's been been about a week and a half, and told him what I was doing for it. And he was like, yeah, that doesn't sound like a cold, that sounds more like, probably a bacterial sinus infection. He's like, you need to treat that. And I was like, oh, we're our own worst doctor, right? Or it's like, if you try to diagnose yourself, you're not going to do a very good job. And I kind of, I'm a man, so I sometimes, when it comes to myself, have this little like, yeah, I'm okay. Like, just tough it out. It's not that bad. And he was like, yeah, don't do that. So he really wanted me to take some antibiotics because it had been going on for so long. And he was concerned that, it was going to get up, because eventually what happened is this all started to really hurt. My sinuses got puffy. This whole area was really puffy, really red, and very tender. It actually was keeping me up at night, because when I would lay down, it was almost like all this stuff would settle there, and it was this pressure. My face hurt. Like, I've never experienced face pain before. And everything was really puffy and swollen. My face hurt, my head hurt, I couldn't breathe. It sucked. So I started to do something that I want to share with you here. Which is I started doing a medicated neti pot. And I tell you, that medicated neti pot that I did knocked that thing out in a matter of probably 2 days, 3 days, really, really quick. So I want to tell you about the medicated neti pot that I did, the herbs that I used, why I used those herbs. Well, I may not get into too much detail into the herbs. We might reserve that for another discussion, but I will talk about the medicated neti pot overall as a method of topical application of herbs for treating the upper respiratory tract. But before I do that, for those of you that may not know that much about sinusitis or rhinosinusitis, I wanted to just share a little bit more about this, this problem, so you can just be a little more educated about it. So essentially, anytime you hear rhinosinusitis or sinusitis, we're really talking about any itis. Typically always means infection or inflammation. Anytime there's an itis, there's usually inflammation. Sometimes that can be associated with infection, sometimes not. Typically, when we're talking about sinusitis, more often than not, this is associated with some type of infection in the sinuses. Now, the sinuses are 4 paired cavities in the face, so you got 4 on each side. And really, the whole premise of the sinuses are to secrete mucus to protect the respiratory tract from the outside world, right? This is the whole function of the mucosa. Obviously, you're breathing in through your nose all the time, and you're breathing all kinds of stuff in there. So the sinuses are really, they're designed to trap foreign materials from getting deeper into the respiratory tract. Whether that be particulates, whether that be pathogens, that really is their function. So, I mean, in a way, getting a sinus infection is, if they're doing their job, basically. While obviously any infection is not good, I would say having a sinus infection is better than getting, say, pneumonia, right? When we're talking about infection of the respiratory tract, the lower down, the further down in the respiratory tract that infection goes, the more dangerous it becomes. This is why pneumonia typically is kind of the most severe type of respiratory infection we typically think of, because it's so deep within the lungs and it really impair breathing. So conversely, like for example, with the urinary tract, the reverse is true. The urinary tract really is kind of like your respiratory tract flipped upside down. So whereas your respiratory tract, you got your main tubule here, right? Your trachea, which branches into your bronchi, and you got your bronchioles and the lungs, right? Well, you take that whole thing and you flip it upside down, and you've got 2 kidneys with 2 ureters to connect to a bladder with the urethra coming out. So it's really, they're kind of mirror images of one another. So at the urinary tract, the higher up an infection goes into the urinary tract, the more serious it is, right? This is where something like urethritis or cystitis is not nearly as serious as a kidney infection, right? So sinus infection, not as generally considered as serious as something like pneumonia, but long-standing infections of the sinuses can spread and turn into a pretty serious situation. So obviously they should be treated. A useful delineation of sinusitis could be to think in terms of how long the infection has been present. So you have your acute stage, you have your what we might think of as subacute, and then you have your chronic infection. So acute, we would say something, for under 4 weeks. Subacute would be 4 to 12 weeks, and chronic would be 12 plus weeks. You can have different types of pathogens can cause sinusitis. So this is not just something that accompanies viral infections such as the common cold or influenza, which very commonly sinusitis accompanies that, right? Whereby you've got the stuffy nose, the runny nose, very common symptoms with the common cold or influenza. Those would be viral. Typically, the more acute sinusitis are associated with that, right? Just like I thought, I was like, oh, it's just a common cold, not a big deal. Subacute, we're going to be looking more into that transitioning from a viral infection into a bacterial infection. And this is where it's very common to see where symptoms will go away for a little bit, which is essentially the viral infection departing, but then the symptoms reemerge stronger and more intensely with more vigor. And that's typically when the bacterial infection sets in. And that was exactly what I had experienced. And it's funny because, you study all this stuff. You study health and pathology and pathophysiology and anatomy and physiology, and you think you got a good sense of what's going on with the body and learn about all these things. But then when you're experiencing it, it's like sometimes all that just goes out the door and you forget all that stuff. And it was funny, I had learned all this stuff at some point and I knew it, but for some reason, this is why we're our own worst herbalist or physician or doctor, because we lack the detachment to observe ourselves from a distance and to really be able to analyze and see what's going on. So this is, the transition from acute to subacute. Usually you'll see that the symptoms go away and then come back, but much more strong. And that was totally what happened to me. A minor irritating stuffy nose turned into puffy, swollen, painful face, inability to breathe at all whatsoever, total mucus factory. Then the transition from subacute to chronic, we would say, is where fungal infection can enter into the picture here. And what is very common actually for chronic sinusitis is that we see a combination of both fungal and bacterial infection in the sinuses, which is not good, right? So but the fungal infection can be a major component of that. And this is why when we're considering if you ever get someone with a chronic sinusitis situation, you want to consider an antifungal approach as alongside an antibacterial approach. Now, a lot of people out there say, oh, if your mucus is green, it's bacterial. If it's clear, it's viral. I really don't know how much validity there is to that. I don't think that's super reliable. I think what is very common is that, I think a better way to think about it is that anytime you see mucus that is yellow to green in color, that usually indicates greater levels of heat. Okay, so that indicates heat from a traditional perspective. Which, if you think of, mucus is supposed to be, thin, flowing, clear. Well, if there's a lot of heat, you're cooking fluids off, basically. That mucus becomes more concentrated and thickened, congealed, and has more of that coloration to it. So it's more of a sign of heat than it is necessarily of differentiating bacteria bacterial or viral infection. Well, neti pots are great and all of that, but free workshops are even better. And that's why I want to make sure you know that September 22nd, we are going to be opening up our free Vitalist Herbalism mini course. This is a 100% free 3-part workshop series where I'm going to be covering for you some of the fundamental principles and practices behind the traditional practice of Vitalist Herbalism. That's right. This will help you get over the allopathic approach that just sees the symptoms within people and forgets the root cause, that just thinks about what plants are good for and forgets about their true holistic nature. So be sure to mark your calendar for 9/22/25 for the Vitalist Herbalism mini course. You do not want to miss out on our annual workshop series here this fall. So be sure to click a link in the profile there if you would like to get on the waiting list so you can be first in line to join us for the Vitalist Herbalism mini course, September 22nd, 2025. And with that, let's get back to learning about how to put a bunch of herbs up your nose through a neti pot. So what are the common symptoms of sinusitis? Well, obviously nasal congestion, difficulty breathing, the classic stuffy nose, sometimes stuffy and runny at the same time. So it's like all stuffed up, can't breathe, but yet you're dripping. So with the runny nose, you can get leakage out of the nose or leakage back into the back of the throat. So this is where that's what's referred to as post-nasal drip. And that can be really, really irritating to the throat. So sometimes people can get a sore throat simply from that post-nasal drip. People commonly have to constantly be clearing their throat, and there's just this constant irritation basically in the back of the throat. There can be pain in the face, headache, redness, pressure. Like for me, it was whenever I would push that, it was really quite painful. And you look in the mirror and you could almost see, this area here and some of the areas up here were puffy. You could literally see how puffy and red it was. Yellow-green mucus typically will indicate infection with heat, as I said. Sometimes it could be because you're sick in this situation, right? So fatigue, sometimes there can be fever, difficulty sleeping from difficulty breathing. If left untreated, bacterial forms can spread to the eye, the brain, or even nearby bones. So we do want to, you don't want to do what I did and kind of disregard it and think it wasn't that big of a deal. I feel like a stuffy nose for a lot of people, it's like, yeah, it's annoying, but it's not like, oh, I got to stay in bed all day, I'm so sick. Most people can tough out a stuffy nose and not really, and not really be that big major of an issue. It's usually once there's like a major cough and fever where people are like, okay, I got to take a day off and rest and stay in bed and things like that. But I'm here to say that, don't leave that stuffy nose, the sinusitis, left untreated. So common approaches to colds and flus, which is usually when people have these types of symptoms, right? People are doing diaphoretics for the fever. So maybe you're drinking yarrow, elderflower, peppermint tea. A lot of people will be pounding the echinacea, right? They're taking, maybe 2 dropperfuls of echinacea every few hours. They're taking tablespoons of elderberry syrup, maybe, couple thousand milligrams of vitamin C, maybe 15 milligrams of zinc, etc., right? They're doing all the stuff, all the things. Here's the problem with that approach, though. Herbs don't reach the sinuses very well when you take them orally. Think about it. Your sinuses are up here. You put an herb in your mouth and swallow it, or you drink the tea, or you take a tincture. So think about it. You swallow the herb. It's got to go down in your stomach. A lot of herbs absorbed in the buccal mucous membrane, especially tinctures, and in the stomach, small intestine, absorb that, travel through, maybe go to the liver, have to deal with maybe get into the circulation, circulate through the blood, cross the blood-brain barrier, get up into the sinuses, all these little bones, right? That's like, there's a lot of complicated bone structures up here in your face and your sinuses. It's all very obviously blood-brain barrier. It's like very protect, not necessarily blood-brain barrier, but yeah, that's probably not the most accurate way, but I'm saying like getting circulation up into the head, let alone getting it to the sinuses, is very difficult, right? We've got all of these complicated bone structures. It's not very well vascularized, small capillary beds. Point is, it's difficult to deliver herbs to your sinuses through ingesting them internally. The only thing that you will commonly get orally from herbs, or the best things I think to help clear the sinuses, would be your super duper pungent things, like wasabi and horseradish, right? If you've ever, gotten, sushi and got the good wasabi, and maybe you get it a little too hot and you take it, it's like, woo, right? It's like a slightly altered state of consciousness for a little bit there. That wasabi really goes up and clears the sinuses. This can also occur with cayenne pepper. This can occur with horseradish. Like the really, really hot things can get up there. Otherwise, drinking herbal teas, taking tinctures, not really commonly going to get up into the sinuses very well. So this is where in comes the Herbal Neti pot. So for those of you not familiar, I'm sure y'all are familiar with neti pot, but this is a practice. The neti pot does come from Ayurvedic medicine, right? Neti is a practice of irrigating the sinuses. Essentially, a neti pot is a special kind of pot that has an angle. It looks like a little tiny teapot, but it's got the angle coming up so that you can tilt. You insert the pot up your nose and then you tilt it. And then that is irrigating up through and then coming out the other nostril. And you're basically irrigating, you're washing all of your sinuses clean. Now, what's really cool about this is that rather than just using water, and typically you're using a saline solution here, right? So if you just did water, it really irritates the mucous membrane. So you usually want to make a saline solution. Instead of using just water, you can use herbal tea. Now, one of the things that I think is really important to consider here, though, is that, okay, so we're talking about treating an infection. So oftentimes we were talking about being holistic in our approach to herbal medicine, talking about, being vitalist in our approach, meaning we want to look at the whole person. We want to consider all attributes of that person. Typically, especially when we're working with people longer term, you want to think about their diet. You want to think about their lifestyle. We want to think of environmental factors, social factors, what might be contributing to the problems that they have, and always, on the one hand, alleviating suffering and making their life a little better, but while at the same time making sure you're addressing the underlying root cause, right? We don't want to just mask symptoms or suppress symptoms by any means. Now, there are sometimes where a little symptomatic suppression is necessary, but more often than not, we want to alleviate symptoms while addressing root causes, right? We want people to heal, ultimately, right? We want them to heal, and which means we got to get to the underlying root cause of the issue. We want to alter the physiology, the physiological processes, the ecological state of the tissues. And that's all true, right? And then when it comes to infection, we've got the whole, germ theory versus environment, right? Why do we get sick? Is it because a germ comes in and invades the system and that's what makes us sick? Or is it that we're living out of balance, and now our tissues, the environment of the body is such that a pathogen can come in and set up shop, right, and start reproducing and make us sick. So, right, it's in a way it's like a chicken or the egg thing. I'm not sure if there is a right answer. I think it's a little bit of both. So it's, so there's susceptibility factors. Obviously, there's vitality factors, how good your immune system is, et cetera, et cetera. So oftentimes what we can see is that on the allopathic herbalism side, or just allopathic medicine side, the approach is kill the bug, right? Give an antibiotic to kill the bacteria, give an antiviral to kill the virus, give an antifungal to kill the fungus. On the other end of that spectrum, you have people that are really firmly entrenched in the vitalist model that really might reject that approach and say, no, don't even think about trying to kill the bug. Just change the environment. Change the environment of the tissue, and then it's not hospitable to that pathogen, and then you won't have an infection anymore because they just can't live there, they can't reproduce, they can't survive or thrive. I'm always like, okay, does it have to be either or, right? Like we can do both. We can do both. And so I think yes, absolutely, we want to consider the state of the tissues and match our herbs really to the energetics of the tissue state. So if the tissue is hot and damp, we want to give cooling, drying herbs. If it's dry and cold, we want to warm it up and we want to moisten it, right? We want to change the ecological status of the tissue to bring it back to a temperate place. Not too hot, not too cold, not too wet, not too dry, not too tense, not too relaxed. But if we know there's a bacterial infection and we have these herbs that have all these compounds in them that have clearly demonstrated to kill those bacteria, why not use them, right? So that's the point I came to, I'm kind of going back to my story. ND says, you should take this antibiotic. I'm like, I really don't like antibiotics. They have wrecked me in the past. I've spent many, many years trying to heal myself from problems that antibiotics have caused in my life because I've taken them a lot. Like every year, once or twice a year, my whole childhood, I was taking antibiotics for strep throat because I would get really bad strep throat almost every year. I've taken a lot of antibiotics in my life. I'm like, I'm not trying to backtrack here. So he said, all right, do your thing. Take the antibiotics within 3 to 4 days if it doesn't get better or resolve in that time with whatever you want to do. My ND, he's like, I know you're an herbalist, just do your thing, whatever. So this was the thought that I had was, okay, well, let's think through the state of the tissue here. And also let's think through something that's going to have an anti-effect, right? And I'll say I admittedly was on this end of the spectrum for a very long time. And I was really like, I don't think of herbs in terms of antibacterial or antifungal or antimicrobial effects. Like, I think my mind is changing on that, actually. I think I'm starting to embrace the concept. I'm embracing a little bit more of an allopathic approach. I think my pendulum is swinging more towards the middle on this one now. So I was like, okay, well, I also want to put some antibacterial herbs in here and some antifungal herbs in here just in case there's a fungal component. Now, again, taking antifungal, antibacterial, viral herbs orally usually will not address a sinus infection very well. Taking things orally for the immune system, that's all good. General immune support, the sore throat, fever, cough, compromised immunity, that's all good. But a lot of times that does not touch the sinuses. So this is where the topical application comes in to address the infected tissue. Quite similar in a way that we would think of putting herbs topically onto a local infection on the skin, right? I mean, think of it. You're like, oh, I have an infection on my skin. Are you going to be like, yeah, drink some antimicrobial herbs for that infection on your skin right there that you could reach out and touch? It's like, that doesn't really make any sense. The same is true for the sinuses, right? Or really any infected tissue where you can get a herb to touch it. It's like, take the herb that's going to touch it and have that effect. So the same, we want to think that way. So here, this is where the neti comes in, using it to irrigate. Oftentimes neti is thought of as just a saltwater rinse to irrigate the sinuses. It's a really great environment to deliver some herbs. So let's talk about preparing a neti pot. So typically you want to make sure you're using really clean water. I don't recommend using, especially if you're out on land and you're in a well, you want to filter your well water. I'm on a well, but when it comes to neti, it's either like, I'm either going to boil the water first or I'm going to filter it. You just want clean, sterile water. Same thing I would say goes with city water. Just filter it, boil it, sterilize it. You just want to be a little bit careful because there can be other things in that water that irritate the sinus mucosa. You want to use pure non-iodized salt, sodium chloride. I try to avoid using those broad spectrum mineral salts like a Himalayan or a Celtic. I just use the neti salts because they're just clean, pure sodium chloride. They're also very fine. That way I make sure I get a good dissolve of the salt. You definitely don't want like salt chunks going on there, right? So typically a ratio of, I would say a quarter to half a teaspoon to 8 ounces of warm water. Remember, don't use cold water. The cold water is uncomfortable for a neti. Also, the salt will not dissolve very well. So you want to just have that water be warm. Some people will add a quarter teaspoon of baking soda to the solution. It makes it a little bit gentler. It kind of buffers it a little bit. Makes it a little easier on the sinuses. That's optional. You don't have to do the baking soda. And that's typically how people do neti. Now, the magic comes in where rather than simply using boiled water with salt, you can use an herbal infusion or decoction to bring a greater medicinal virtue to that neti pot. So that would be considering, okay, what herbs will have a topical antimicrobial, antibacterial, antifungal effect that we could add, that we could decoct or infuse and do in the neti pot there. Another way that you can do it, and this is the way I did it because actually I had to travel while I had this infection. So I had to get a little bit creative. And so what I did was I used tinctures. I was adding up to about 45 drops, roughly 1.5 mils, maybe sometimes it'd be 60 drops if I really wanted to make sure. Once I felt like 45 was kind of a sweet spot, at least for my size neti pot. I found getting up around 60, that would be like, okay, that one was a little bit uncomfortable. So that would be just making the neti solution with the salt and then adding up to 45 drops of tincture. Not 45 drops per herb. I'm saying 45 drops total in the whole neti. Now that might not seem like very much, but when you're irrigating that through and if you select the right remedies, it's totally strong enough and works very well. Any more than 1.5 to 2 mils, you really do run the risk of burning and kind of irritating your sinuses, which if they're acutely inflamed and puffy and swollen and already painful, that's not bringing relief by any means, right? It's just making it worse. Okay, so what herbs would we want to use for a medicated neti? So obviously we'll want to give remedies that have the broadest spectrum of medicinal actions that would most benefit the symptomatic pattern associated with sinusitis, which I would say more often than not is a combination of heat, dampness, and laxity, right? So we see this Dampness is obvious, right? Everything's puffy, it's swollen, it's boggy, it's, dripping, you're blowing your nose. There's this constant excessive production of mucus, right? I mean, it's pretty obvious that that's dampness. The heat oftentimes is there, especially if you're seeing that yellow-green color to the mucus. Heat, oftentimes if it's like inflamed, like if you breathe in through your nose and it's like, oh, it kind of hurts back there in the sinuses, that's heat. If you see redness in the cheeks, red coloration, obviously if there's fever and other heat signs, that's pretty clear. And then relaxation or laxity of the tissue. This is where you get that postnasal drip, the runny nose. Basically the mucosa are just leaking excessive amounts of fluid. Those fluids tend to be more clear. Oftentimes I find that laxity tends to be more earlier stage, and then everything tends to get really puffy and swollen and boggy, and then that fluid stagnates more as it goes later on. So anyways, therefore, the properties and herbs we would really want to go for would be cooling, drying, and tonic or astringent, okay? And so what this is going to do is it's going to tighten the mucosal membrane. They're going to dry the local dampness. They're going to cool the heat and the irritation and tighten and tonify that leaky, boggy mucosa. Now, if there's an infection, obviously giving some form of antimicrobial is a good idea. Typically, if it's a home treatment, you haven't gone to the doctor, you don't know if it's viral, bacterial, or fungal, that's okay. Like, you won't know, but there are many herbs that will really kind of address any of it, regardless, because there's many herbs that are pretty potently antibacterial and have antifungal properties and might have an influence on something like the common cold virus or an influenza virus. So I would say the best herbs to select here would be something that has both antibacterial and antifungal properties. Again, especially if it's going more mid to later stage, subacute to chronic. You're creeping up on that. Okay, this has been going on for about a month. It's like, okay, I would switch over and do something that specifically has antibacterial, antifungal properties. Now, obviously, you don't want to wait that long. If you've got sinusitis, just treat it. Treat it initially. Don't wait for it to go more serious than that. Associated with infection usually brings along with it a degree of inflammation. So selecting herbs with inflammation modulating properties would be beneficial. Want energetics to be cooling and drying. And typically we want, and this is an important one, you really want to avoid anything that's excessively pungent, hot, would likely irritate the mucosa, right? Like, don't put cayenne in there. Don't put ginger in there. Don't put, even some of those aromatic mints could be too intense to put into a neti, like thyme, oregano. Those are pretty hot, spicy herbs. They can be a little too much. Here, I honestly really like the use of more bitter herbs, bitter, antiseptic, antimicrobial, cold, dry herbs tend to be very, very nice. I especially appreciate berberine containing herbs. I think honestly, if I had to select any herbs for this, I would pick a berberine containing herb out of all of them. So that could be something like goldenseal, Oregon grape root, berberis, Chinese coptis, yellow root, philodendron. These are all berberine containing herbs. And that alkaloid is it's an awesome alkaloid, where it's very, very good, very strong, very broad spectrum, very active. And I think those bitters in general tend to have a bit more of a tonifying effect to mucosal membranes. And that is especially true of goldenseal. Now, of course, goldenseal is ecologically at risk. It's expensive, but it's really indispensable here, in my opinion. I think it's the best of the berberine containing herbs. Granted, I haven't used the Chinese berberine containing herbs like philodendron or coptis that much, but I've used all the other ones. The berberine or the berberis and the Oregon grape and things like that. And I think goldenseal is really, really great for especially this, where you get that really boggy, damp, leaky, infected mucosal membrane. That's really what goldenseal is really great for. Even though there's a period of time where it was touted as like the natural antibiotic. Yes, it has some antibacterial properties, but that's not all it does, and it's not going to treat all bacterial infections, etc. But this is one where goldenseal is very, very good. And indeed, there are 4 or 5 really, really great herbs that I absolutely love that I think match the pattern of treating sinusitis in that way. But as you can probably tell, sometimes I can get real chatty when I'm talking about herb stuff because I get excited. I like talking about these things. I think it's fun. Hopefully you're getting some value out of it. But if I was to try to cover those 5 herbs here in this video, it would go on for way too long. And I'm trying to keep Plant Path episodes to, around 30, 45 minutes. So you will have to check out another episode of the Plant Path where I'm going to talk about some of my favorite remedies to consider for sinus infections. So be sure to check out my top 5 remedies for a sinus infection. These are some of the main herbs that I used when I was treating my sinusitis. And I hopefully you learned something new. This is kind of an extension of a previous post I did talking about redefining topical application of herbs. So I really wanted to zoom in on this medicated neti pot idea because I think it's a fantastic way to think about utilizing herbs. I also want to mention too, actually, that if you ever find yourself out in the world around other people that are sick, they've got the stuffy nose, the cough, the cold, the flu, the whatever, and you're like, geez, how did I end up around this person? I really don't want to get sick. I highly recommend you do neti when you get home. This is, if you, like I said, this is the sinuses. This is really your first line of defense. If you irrigate that, clean all of that out, even just a straight neti, just the salt water can be very, very good for flushing that out. If there's any viral or bacterial, particulate or whatever, little critters up in there, they'll really rinse it out very, very nicely. So it's one preventative means that I do suggest. I guess on that note, I also don't recommend doing neti all the time. Some people say, do neti every day. That's really not a good idea. It can really, really dry out your mucosa. It can really irritate the sinuses over a long period of time. So I really prefer to reserve neti for acute use, or in this instance, I'm just describing, use it for more of a preventative means if you find yourself around people that are sick. So anyways, I wanted to mention that because I think that's another great application of neti. So hopefully you learned something new. Hopefully this inspires you as a new way to consider topical usage of plants. Hopefully this is a useful therapeutic approach for addressing sinusitis. I hope you use it. And I hope it works. And I know it works because it worked for me and it's worked for lots of other people too. So it'll work for you as well. And if you want to learn more about the herbs that I specifically used in my neti for sinusitis, be sure to head on over and check out my top 5 herbs for a sinus infection. So thanks so much for making it to the end of this episode of The Plant Path. If you're watching anywhere or listening anywhere other than our website, be sure to go on over to Evolutionary Herbalism Check out the Plant Path over there. We got tons of free content. Be sure to join our mailing list so you can get all the updates when they're happening. That includes free workshop series, webinars, as well as special enrollment periods for our online courses and membership to Materia Medica Monthly. And if you're listening on podcast, Spotify, YouTube, hit that like button, hit that subscribe. It really does help support the channel. And I truly appreciate you being a part of the community. Thanks for tuning in. I appreciate your time and your attention. It really does support what we do here more than you might know. So hit that like button and subscribe. And that way we can continue to put out good quality, free herbal education to the herbal community. So thanks once again. Take care and be well.